Trispecific antibodies are a novel way to target malignancies, and they have some significant differences from bispecific antibodies. Obviously, the first is the third antigen being targeted, hence the word tri, versus bispecific antibodies often have one antigen on the tumor, one antigen on an immune cell, bispecific. Trispecifics have the advantage of potentially having two ways to target the cancer cell, so that if one antigen is lost, the other antigen on the cancer cell hopefully will still be there. And so there should be a lower chance of immune escape by loss of an antigen, just because there's two chances for the antibody to bind to the cancer cell and to then bind to the T cell. So trispecific antibodies have significant theoretical advantages, although as of yet, we haven't seen late-stage clinical trials with trispecific antibodies to validate if that is practically a reality or if that's a theoretical advantage.